Still waiting for my stronger lenses and a microphone, but I did get the mic jack, and I'm using this cheapy microphone, which I think I paid about $2 for, to see if this helps them. And I've done some manual adjustments. This is just for techies on my smartphone that's hooked up using the app, and so I'm shooting at 4K, 60 frames per second, and I've done the white balance to something. I'm not sure what it is, but we'll see if it looks better. It looks better from what I'm seeing right now on the smartphone. Okay, so let's get with it and see if this works better today. So what's been happening? Well, getting spikes in cases. Yesterday was the second biggest ever after the last one. We had 32 new cases, and 31 of them were local transmissions, including 2 foreigners. The majority of the cases were down in Denpasar at art market, a market called Pasar Kumbasari, and it's been shut down until June 15th. People being tested there, so that's not good. And we've had 6 foreigners over the past week tested positively. No word on where they're actually from. I'm still trying to find stuff, and I've been looking at the Bali Covid-19 update on Facebook that Jackie Pomeroy runs, and she doesn't have any either. So if she doesn't have any, I can't find any. And I've been going through Indonesian newspapers and the government Facebook pages. So I don't know. Maybe they're just keeping it secret. But foreigners are getting it too. So, and I'm going to talk about this shortly. Foreigners need to start wearing masks and following social distancing and behaving themselves. So let's look at the numbers. 640. We're up to 640 now. Positive cases. 412 have recovered. Good. 5 deaths still. Supposedly there was another death, but it hasn't been put on the official figures yet. Maybe that'll happen tomorrow. And we have 223 active cases now. So remember, it wasn't long ago we were at, if I can find a link and put it up here, we were at under 100. Now we're up to 223. So this is not going away in Bali, even though some people would like to pretend it is. And speaking of the numbers, we had the biggest spike in the country as well. So we're getting hit by the post-Lebaran effect, looks like. Certainly around the country, if not in Bali as well. So local transmissions, and the governor says that Bali is not ready to open up, and I'm going to talk more about that. But he also says that the growing number of new cases is directly related to a low level of awareness among residents who are not practicing health protocols, and I can see that is a problem. There's hand sanitizers in some places. If I can find a video from when Zoe and Masha the bear and I were out walking the other day, I'll show you. But in front of just a couple of shops, not government offices. And most people up here anyway in Singaraja are wearing masks, but social distancing non-existent. It's just not happening unless you go to places like the Contra Telpon or government offices. We're going to talk about the opening in a few minutes, And so what else is what are we going to talk about today besides the numbers? We're going to talk about the government offices are open again, yay. Non-COVID related case, but if what the newspaper says is true, this is something for people to think about. And I'll give another example about an Englishman who falls into a well and is there for 6 days. And Siloam hospitals around Indonesia will be providing COVID-19 serology tests. So good news for those people that want tests, especially ones that are going to be flying. And then from the Canggu Info Facebook group, some really bad behavior in Canggu yesterday. Police and other local authorities and local village security had to break it up. So let's get into it, because let's get into it. And thanks for the comments, especially the ones about the audio. I know I'm trying this today. We're going to see if this works. I do have a microphone somewhere in between Jakarta and here, and so we'll see how that works, along with my filters. Okay, so first story then. Let's do the government offices. So the government offices, and I mentioned this in the last video up here, if you want to see last video, that the government offices would be opening. They open Friday, allegedly. I don't know, I didn't go to the offices, but this is Thursday now, so they should have been open for 5 days. And I guess so, because as a long-term resident, somebody on what they call permanent visa, but it's not really permanent, but it's 5 years. Anyway, my KTP, my Indonesian identity card, I wasn't able to update it back when I got my my new KTAP, my resident visa, and I went to the government offices to update it. And what happened? They said we waited and waited and waited, and the guy did not want to take us. He said he's a foreigner. I'm not really sure what to do. I said it was simple. Last time it was just simple. You fill out the form. So we waited, and we eventually got taken care of, and it was simple. He filled the whole thing out in about 10 minutes, and then he says, oh, well, we don't have any blank cards, so I can't give you your KTP, so you'll have to come back another time. Okay, so we talked to other people, and they said the same thing. Yeah, it's true. And so we waited till the first of the year when they were supposed to get new cards, and then COVID happened and everything. And so yesterday, a local government guy came by to pick up my papers, my paperwork, to go nicely and get me my card. So I'm waiting for it today. Should be done in a day, he said. So, yay. So government offices are open. Good news if you have government business to take care of. And, the Englishman falls into the well. So there's this English guy. He's a young guy. This is not COVID-19 related at all. He falls into a well, kind of off the beaten path down in South Kuta. And so he falls at 6 meter deep well. Okay, so that's deep. You look at these walls, I think they're, the ceiling is like 3 meters, so 6 meters is a ways down. So he falls down, he gets hurt, and nobody can hear him because he's kind of out. I guess it was a garden area, it looks like it. So he falls down the well. Why did he fall down the well? Well, according to the story, he was being chased by a dog, and so he was running away from the dog and didn't see the well, and he fell into it. Now, that's a real believable story, and this kind of stuff happens. This is one of the problems. I like dogs. I'm sorry if you're a dog person, but these dogs should not be wandering around the streets like they are, because some of them are real aggressive. I had one of my daughters had to go to the hospital because a dog came after her while she was on her motorbike, and she crashed. Fortunately, a guy was right behind her because she panicked, and he helped her and got her to the hospital, and she had to have some stitches. And I've been chased by dogs. My kids, one of my kids was bitten by a dog. So yeah, the dog thing is a problem. Anyway, let's get back to the story. So he falls into the well, and he's calling out for help. Finally, a woman hears him. She's out in the garden area. She hears him. She doesn't know really what to do, so she gets somebody else, and they both kind of check, and they finally call Bali Search and Rescue, and they came and they used the COVID-19 procedures just to be careful, and they were able to lift him out of the well, and they took him to a local hospital where he's being treated. Now, it said in the article that he had a broken back. I'm not sure that was what it is, but the moral of the story, watch out for dogs. Yeah, I like dogs too, but I don't like loose ones. And there are streets here now in our neighborhood that I just will not go through because there's wild, aggressive dogs that hang out there. So, enough for the dogs. And Siloam Hospital, is going to provide COVID-19 serology tests. So all Siloam hospitals in Indonesia are going to provide this serology test called the Alexis Anti-SARS-CoV-2 serology test, developed by the Swiss multinational Roche. And the test is designed to determine whether a patient's been exposed to COVID-19 and whether they've developed antibodies against the virus. Excuse me. The tests are going to cost 199,000 rupees, way cheaper than the other tests are being given. So that's about $14. So they're cheaper than the rapid test, cheaper than the PCR test. And according to the Indonesian country representative of Roche, Ahmed Hassan, the test has 100% sensitivity with no false negative results. So this has been cleared by the FDA in the United States, by the public health in the UK, and it's widely used, according to this article, in Singapore. So good news. If you need a test, you can go to Siloam, and the price should be $199,000. I don't know. Siloam's not the cheapest place in the world, although I happen to like the hospital. I've been there a number of times, and I like it. Some foreigners don't. I do. Enough for that. Let's get down to the big question. As always, when will Bali open? I don't know. The governor says it's not time. It's not time to open yet. There's still cases coming. We've got a lot of active, over 200, like I said, I think 223. He said we're putting safety of the citizens above economics right now. And so I think that's great. I support the government in this respect. He said the government's evaluating the situation to see which regencies are the safest so far in terms of numbers and how this is developing throughout the island. And it's certainly not going to be Booling because we're up at the top of the numbers. And that when they decide which areas have the least risk of contagion, they'll consider opening up for the new normal, although at one point He said it's not going to be called the new normal here in Bali. It's going to be called the new era. So whether it's the new normal or the new era, Coster says, no, it's not time. And people have been opening things up and he's closed them down. Like I said last week, or the last video, a couple of beaches were open, immediately crowded with people. He ordered them closed down. Now, last night, and I'm not going to put the video here. Maybe I'll put a link to it. So let's see if there's a link down here to it. But at Oldman's, which is from what I hear, a popular hangout in Canggu, lots of people out partying. A lot of foreigners. Looked like some locals too. The video was not very good. So hard to tell. It was dark and not real clear. Definitely foreigners. It looked like some locals as well. Not many people wearing masks. It's a big joke. And this is causing a lot of people to say we can't wait to get rid of the foreigners. Get them out. But as long as we continue to have these incidents like the beaches and the old man incident, and locals are not free of blame here. This is not just a Western situation. There's locals as well. As I said, you go down to downtown Sigareta, social distancing, forget it. And my guess is that that's probably similar everywhere on the island. People are just not social distancing, although masks seem to be pretty good now. So there was a good piece, and it's a thought piece, and talking about what Bali is going to be like. I highly suggest you read it. A lot of things I agree with: quality over quantity, emphasize the culture. Bali can exist without foreigners. There's this attitude, and you see it all the time on Facebook and other social media. Foreigners go, if it wasn't for us, you all be starving. Balinese would not be starving if it wasn't for you. Jesus, get over yourself. The island existed before tourism. The island will exist after tourism. It made it through the bombing. It made it through volcanoes. It's made it through everything. People are very resilient, very resourceful. They do not need tourist dollars. The island can be rethought. The whole concept can be rethought, and it'll be interesting to see if it's done. There's certainly been some suggestions from the government and intellectuals and some other players in the culture about focusing on the things that are important in Bali: culture, religion, support agriculture, get away from this mass tourism. Bali doesn't need to be a theme park, but as one person says in the article, you're talking about money, and money talks, and it does. So we'll see what happens. But I suggest you read the article. It's really good. I agree with it completely. And so that's it. We don't know when it's going to open. There's still that magical October date, right, that floats around, but it's clear. People had said we were going to open in June. Well, here we are. This is June 11th, and we are not open. And the people that want to open July 1st, doesn't look like you're going to do that either. So is it going to be October? Could be. We'll have to wait and see how things develop. And that's it for today. I want to get this and take a look and see how the video turned out, how the audio turned out, if this is working, and what happened when that voice came up and talked about agriculture. Yeah, I didn't do it this time. I don't know where that came from. Okay, so that's it. Be safe. Follow the rules and regulations.